Hello friends, myself Dr. Devashish Mukherjee. I have worked as a senior research fellow in Central Council for Research in Homeopathy and Central Institute of Psychiatry. Today I am going to discuss about an important drug, Digitalis. Digitalis purpurea. Digitalis has action on heart, it has action on liver, it has action on spinal cord, and it is an important drug. It is being used and abused also. So let us see how to use Digitalis in our practice. Digitalis generally affects our heart. It affects the weak heart. It causes the accumulation of calcium inside the heart, and so it strengthens the heartbeat. And it helps in those conditions. You will find in the cases when you enter the room of a patient and the patient is very weak, he is afraid to move because he feels if he would move, his heart would stop beating. There is cyanosis is present, means bluish discoloration of his face, fingers and nails will be there. There will be accumulation of fluid in his lower extremities, that is there is anasarca may be present, that is there is accumulation of fluid in his lower extremities, in his hands and all, and the patient is in a precarious condition. Patient complains that he feels that if he would move then he would die. When you examine his pulse, you will find that the pulse is slow and it escapes in third, fifth and seventh beat. On these particular occasion, you can prescribe Digitalis, and Digitalis can help in these cases of failing heart. But be very careful because Digitalis has many toxic effects also. I have seen many homeopaths to prescribe Digitalis mother tinctures indiscriminately. Digitalis has cumulative action, and we have seen many bad effects from Digitalis if it is used, overused, and if it is not used under the medical supervision. So, Digitalis should be used in potencies, especially 6C or 30CH might be used. If you go through the books of Dr. Robin Murphy and Dr. Butt, and you will find that there are many cases how the Digitalis is being used. I have gone through the books of Dr. Nash. The Nash demonstrates a case in which the patient was very weak and the patient was unable to breathe, and there was all these symptoms of heart failure, and he has prescribed the Digitalis in different potencies, but there was no work. At last, he procured some of the leaves of Digitalis and he crushed and put some hot water in it and let it drink. He advised the patient to drink that particular fluid. And after few hours, there was much relief and there was passage of lot of urine, and the patient felt all right. But be very careful, don't prescribe Digitalis in mother tinctures. It is better to always to prescribe in 6C or 30CH. Let us now analyze the action of Digitalis on liver. It acts on liver. We find the symptoms of jaundice in Digitalis patients and ash colored stool. You will find a patient who is very weak. He is having ash colored stool and he is suffering from jaundice. You will know from particular symptoms that it is a case of Digitalis. So in this short video, I think I have been able to put forward the important points how to prescribe Digitalis to a patient. The main symptom of Digitalis is slow pulse, and the pulse intermetes at about third, fifth or seventh beat. If you find such type of patients who are very weak and who are always afraid to move, then you can prescribe Digitalis in lower dilutions, 6C or 30CH, and observe the effect of this medicine. Thank you. Thanks for watching.